My back hurts by 3 p.m. It's so hard to differentiate between dental clinics these days. Almost every clinic looks the same. I'm not tired physically, but I'm really tired mentally. I think I'm getting burnt out. Do any of these sound familiar to you? What if I told you that one small shift could change all of this? For me and hundreds of dentists that I've trained in the past, that small shift was the dental microscope. If this resonates with you, then this video is for you. Hi, I'm Dr. Sijur Jacob. I've been a microscope user for more than 20 years. Apart from private practice, I've also been training dentists for more than 10 years on how to incorporate the dental microscope into everyday clinical practice. And I can tell you this, microscopes aren't just about magnification. It's about how you work, how you feel, and how your practice is perceived. Let me show you how a dental microscope could be the most smartest investment that you've ever made in your dental career. Let's start with some of the clinical benefits that the dental microscope offers for the clinician. When you work in your dental clinic, what are the technical benefits that you get when you use a surgical microscope? Well, the first and most obvious one is magnification. You can see things really large, and when you can see more, you can do more. Simple procedures, simple everyday procedures like, for example, a general consultation, or say oral prophylaxis, or just a simple cavity preparation, all these procedures become far more magnified and therefore far more easier to do with a surgical microscope. Some of you might think, hey, I use dental loupes, they magnify the tooth, so why do I need to use a microscope? Well, it's not just magnification. What the dental microscope offers is what we call coaxial illumination, which means illumination along the same plane as magnification, which is very different from loupes. You can have external lighting with loupes, but that lighting doesn't follow the same plane as magnification, and that makes all the difference. So coaxial illumination along with magnification, and that's what makes a huge difference compared to a loupe. So that's one big advantage. The second big advantage is documentation. You can examine the patient, and whatever procedures you do, you can do simultaneous documentation without spending extra time. If you are, say, using a loupe or, say, naked eye, then you need to examine the patient, stop what you're doing, then come in with your macro photography setup, or let's say your intraoral camera, then take a picture, then you got to download that onto a system, and then the whole protocol is interrupted. So photography has to be a separate procedure altogether. With a microscope, it's not like that. You are examining the patient, and simultaneously, whatever you look through the microscope, your assistant can just click a button or a remote, and the picture or video gets documented simultaneously. So the documentation capabilities that you get with a surgical microscope are very different compared to any other methodologies that you employ in your everyday clinical practice. And once you have pictures, you can replay this to the patient. So it's very different from anything else. The third and the most important is ergonomics. Microscopes help you sit upright and work ergonomically. Dentistry is a physically demanding profession, and when we perform dentistry, we end up in all kinds of awkward positions. And the problem is that these awkward positions are repeated time after time, day after day, month after month, year after year. And when repeated over a long period of time, it can result in severe injuries, often preventing you from continuing private practice. So ergonomics and preventing injuries is another big advantage that the microscope offers for the clinician in everyday clinical practice. Now let's look at something outside the clinic in terms of the practice itself. How can the microscope help your practice grow? Well, the first thing is differentiation. Now, we are in a state where almost every clinic looks the same. So how do you differentiate yourself? You can't differentiate yourself by making your clinic a little more posh, or adding more equipment in terms of buying a nicer dental chair, or buying a nicer X-ray machine, or buying a nicer sensor, because almost every other clinic can do that, right? Whereas the microscope is not that common. Even if you look at the number of general dentists in your area, you will find that less than 1% are probably using a dental microscope. So if you figure out how to incorporate the dental microscope in your operatory and then learn how to use it in everyday clinical practice, it immediately differentiates your practice from the vast majority of practitioners around you. So differentiation is one big plus point when you start using the surgical microscope. The second big advantage from a practice growth profile is that it encourages conversions. When you are examining the patient under magnification and you click photographs and then you start showing these pictures to the patient is very different. The quality of the pictures in terms of magnification and illumination is very different from what you can get from an intraoral camera. So when you play these pictures to the patient in a consultation appointment, for example, when you blow it up and show those pictures in high magnification, show the patient a simple class 1 cavity or how much calculus he or she has in an oral cavity, the conversion, that is the patient getting motivated by what he or she sees and then coming back for treatment, is extremely high, thereby increasing in procedures done in the clinic and thereby increasing a practice profitability over a period of time. So that's the second big advantage, converting patients from examinations to actual procedures. The third is an increase in fees. So what happens with microscopes is that you immediately are perceived as a premium practice because you're doing something which nobody is doing and you're doing it at a fairly high level. So patients start perceiving what you offer as something a little higher than what the rest of the world is offering. So you are, over a period of time, able to increase your fees because your practice is perceived as something premium. So that's the third big advantage from a practice point of view. And finally, we think that microscopes increases chances of referrals, both from patients as well as colleagues, because again, you are differentiating yourself, you're doing it at a fairly high level. Imagine a patient who comes to your clinic, who's been to other clinics, they are seeing something which they've never seen anywhere else. Most general dental practices don't have a microscope, and if you are a general dentist offering a microscope in your practice, then the patient sees you and then you become a talking point at dinner meetings, and when they're out with friends, they probably bring this as a point to talk about and saying, hey, you know what, my dentist uses this fancy tool, and then you can see everything on a big screen and you can magnify it. And that helps bring more referrals to your practice. It kind of increases the profile of your practice. So these are some of the changes that a microscope can bring about in your dental practice from a practice point of view. The third advantage is from a personal perspective. So microscopes are what we call domino habits. You pick it up hoping to improve technically, but if you start practicing with a microscope for a period of time, you see so many changes personally as well. And I know this because I've been training dentists for more than 10 years. And one of the advantages of having a large alumni is that I can keep track of what changes have happened in a clinician's life on a personal viewpoint, right? Some of these dentists, when they come to me for training, they've already been in private practice for more than 10 years. And then they incorporate a microscope in their practice, and then I keep track of them. What are the changes that I see in them on a personal level? After 2 or 3 years, we find out that there's so many changes. What are those changes? I think the most important change, or the benefit that a microscope gives from a personal point of view, is the reduced chances of burnout. Dentistry is a very monotonous profession. So if you are practicing dentistry, initially it's exciting because you have your own practice and there's some excitement in clinical procedures. But over a period of time, you're doing the same thing again and again, and after a while you get burnt out. When you start using a microscope, suddenly this whole new world opens up in front of you. So it's really exciting to do the same procedures that you were doing earlier, but now you're doing it under magnification. So the same boring class 1 cavity, when you actually start doing it under the microscope, it's really exciting because you start seeing things which you never saw before. So it reduces burnout, and you have something new to look forward to for the next 2 or 3 years. So it will keep you going, it'll keep your motivation levels very high, so it will reduce burnout. So this is one big advantage that we have seen on a personal level. The second is increased confidence. Now, confidence is an inside-outside process, which means that you have to feel good from within, that the work you're doing is worth something, and that brings about some confidence which gets reflected on the outside. When you are practicing with a microscope, you know that you're practicing dentistry at the highest possible level, and when you do that for an extended period of time, it brings about a change in your demeanor. You start feeling good from within, that you're doing something at a very high level, and that translates into how you behave externally, both with patients as well as colleagues. That's the other big change that happens on a personal level. Thirdly, your reputation increases among colleagues as well as patients, because obviously you start doing something at a very high level, and then everything that you do over a period of time becomes a talking point. Your colleagues will start looking at you with different eyes. They start seeing that you're doing something which majority are not doing. So your reputation gets enhanced, both from colleagues as well as patients. This is the third big change that we see on a personal level. And of course, the most important part is your health improves. You start eliminating most of the physical injuries that we see in dentists. Things like neck pain, back pain, these sort of things get completely eliminated if you buy a microscope and use it the right way. If you learn how to use it every day, then the risk of being bogged down by a physical injury is almost completely eliminated. And to me, that is the biggest plus point, because what is the point in doing phenomenally well if you can't get out of bed or you can't bend your neck? Health is something that you can't put a price on, and the microscope really helps you preserve your physical health when you practice dentistry. So these are some of the personal benefits that a microscope offers. Now, when you hear all these things, naturally there are some objections. And one of the most common objections that we hear from dentists is, hang on, isn't this very expensive? Isn't this something that only a specialist needs? Why should I spend so much money? Well, you'd be surprised if you actually do some investigations into microscope. You will find out that they're not that expensive as you think they are. You have options with microscope, and an entry-level 5-step microscope isn't as expensive as you think it is. And secondly, that amount of money that you spend, in my experience and in the observations that I've seen in students that I've trained over the past 10 years, is that you recover the cost of the microscope in less than a year. The most common reaction we hear from students is, why didn't I do this earlier? Not the other way around. In fact, I've never heard a student who attended the course, bought the microscope, and then said, I regret buying the microscope. It's always, why didn't I do this earlier? Cost, I don't think is a really big problem. It's just the perception. And you start doing your research, you will find that it's not as expensive as you thought it was. The second common question is this thing a little too bulky? How do I incorporate it in my practice? I think this is a valid question, because you can't just buy a microscope and bring it into your practice without planning where you're going to put it, how it's going to alter the way you work, and things like that. Yes, if that's the question, I think it's a legitimate question. Fortunately, this is something I can help you out with. If you want to know more, then drop your email in the link that you see after this video or below this in the description, and I will send you a lot of information which will help you or guide you as to how you can incorporate the microscope in your operatory. The third question we get asked a lot is, how do I learn how to use a surgical microscope? Where do I get trained? I think this is where I come in. This is what I've been doing for the last 10 years. Now, if you are from an area where there is someone doing a hands-on course near where you are, then by all means, go to them and learn how to use a microscope from them. And then you could get started. If not, I have a comprehensive online course. It's called Microscopic Dentistry Simplified, which is specifically for general dentists, and it takes you through step-by-step everything that you need to know to get started with microscopic dentistry. If you want to know more, click on the link below and you can have a free preview. You can see how the course is, and if it's something that's interesting, that could be a good starting point. So those are some of the advantages, and as you can see, microscopes are something that don't just affect one area. It's not about magnification. It's something that can change your entire perspective about dentistry. I urge you to consider learning more about how you can incorporate a microscope into everyday clinical practice. If you found this video useful, then do check out some of my other videos on the channel. Don't forget to share it with a friend who you think might find it useful. And don't forget to click on that subscribe button so that you get notified every time I upload a new video. I'll see you next week with another video. Thanks for watching.